Good afternoon. Welcome, and thank you for joining us for our very first webinar in the Desk Side series. My name is Cynthia Brandt, and I'm CEO of the Lucille Packard Foundation for Children's Health. One of our goals here at the Foundation is elevating the impact and the visibility of the faculty at Packard Hospital and Stanford Children's Health. And that's what this webinar is all about. It's about bringing you really timely information from our expert faculty that can help you and your families. So today we're going to do a deep dive on vaping with our very own Dr. Bonnie Halpern-Felsher is with us today. And Bonnie has spent her whole career helping kids avoid risky behaviors, all the things we think of in sex, drugs, and rock and roll. She's a developmental psychologist, and she holds an endowed research faculty scholar position in the Tad and Diane Toby Youth Addiction Initiative. So I have some questions that I'm going to ask Bonnie in a few minutes. Some of you submitted questions in advance. Thank you. Also, there's a little Q&A button at the bottom of your screen, so I encourage you to go right ahead and start submitting your questions now. We will try to get to as many of those as possible. Now, before we turn to Bonnie, I just want to hear or introduce you to one of the kids that Bonnie knows really well. This is a kid just like all the kids we know and care about, but who has an addiction to vaping. So let's start the video and meet Luca.
I was 15 and I was like, oh my gosh, am I having a heart attack? I didn't have a heart attack, I had a seizure. The first time I ever used an e-cigarette when I was a freshman in high school. I was 14 years old and it was my first Friday night football game. The seniors told me that I could get the front row seats if I were to hit a jewel. As a freshman, we had to sit in the back. And unfortunately, I did get those front row seats, but with that, I also gained an addiction. I remember them presenting it to me as very harmless. They told me that it was just water, there was no nicotine. They told me it was vegetable oil. And me being a naive and ignorant freshman, believed all of this because I didn't have any of the real information. The recognition I got amongst my peers was a really gratifying feeling. So it was almost like a rush in a way. After that first month, I purchased my own vape and I would go through a pod a week, but very quickly this picked up to the point where I was using 4 pods every single day, very consistently throughout my addiction. 4 pods a day at the time was expensive. A pack of pods ranged anywhere from $17 to $23. So for that entire period, I was getting maybe 3 to 4 hours of sleep a day. And I didn't grow at all from the age of 14 to 15 and a half. I went from a straight A student to a flunking student and I nearly flunked out of high school. I dropped all sports. I dropped Boy Scouts. Really everything extracurricular and curricular had dropped completely just because my focus had shifted. I became very angry. I had a very big idea that it was me versus the world versus me. I remember waking up in the morning, getting coffee, and going to a friend's house. I thought I was taking a nap, and I was really mad that everybody was waking me up from my nap. And I wake up and there's all these people from EMS, there's my mom and dad, there's their parents, all my friends. It was scary. So I realized, it wasn't a nap. So I had a grand mal seizure from vaping back in September of 2018. And no, it was not vaping marijuana, it was vaping nicotine. And when I went to the doctor after my seizure, I went to a cardiologist, neurologist. It was really horrible. I would go in and out of consciousness. I would double over in pain. I couldn't stay at the football games for long because I just couldn't bear how bad my chest was hurting. For me, what made me turn the corner was rehab. I went to an inpatient program in California for 39 days. It was not volunteer. So for anybody thinking, oh my gosh, I'm so proud of him, he did it on his own. No, I was forced. My mom and my dad, they told me the night before, pack your bags, you're gonna go to rehab. And really, rehab was the last option before I ended up in jail or dead. As soon as I was in rehab and I was not using anymore for those 39 days, I grew 2 inches and I gained 10 pounds. The thing I'm most excited about is furthering education, I think, and Boy Scouts. You know, those were two things that were really big in my life at one point, and I'm very grateful to have them back right now.
Wow, this is so serious. It's the second or third time I've watched that video, and I really have chills. So Bonnie, let me introduce Dr. Bonnie Halpern-Felsher, our very own expert. And Bonnie, of all the things that you've worked on in your career, tobacco, alcohol, risky sexual behavior, why are you focused on vaping right now?
Well, thank you, Cynthia, and thank you everybody for joining us today. This work matters to me because if you look at Luca's story, and Cynthia, I'm with you, I've seen it a few times, it makes me angry, it makes me cry. I'm pissed, I'm angry, I'm concerned, and I'm worried. Why? Well, you can have a healthy relationship with alcohol, a little bit here and there. You can have a healthy relationship with sex if you're safe. There is no healthy relationship with tobacco, period. So, as you said, I've spent 25 years tackling teens and young adult tobacco use. Why am I focused so much? It is the most preventable health risk behavior that we have. It affects many areas of health: cancer, in an adolescent, their brain development, their concentration or lack of, emotions, grades. Luca mentioned a lot of these. These health outcomes are preventable. So we're really making great strides. We had been making great strides in the areas of tobacco control for 20 plus years in my work. And then suddenly a few years ago, when e-cigarettes came on the market, it all changed. We went backwards to where we started. We lost the fight for a while in tobacco control. Luca's story encapsulates it. We have teens who were never going to smoke cigarettes, now using electronic cigarettes. They got the message about cigarettes. But suddenly big tobacco or big vape comes pouring back in around using electronic cigarettes. We have teens who are now addicted. They're having headaches, trouble in school, mental health issues, all the things Luca talked about. And this could have been prevented. Luca's story and all the Lucas out there, and there are many, could have been prevented. So the goal of our work is to really stop the vaping companies, the big tobacco, big vaping, to get ahead of this and really try to prevent young people from becoming addicted.
It is so infuriating after all that progress against cigarettes, and then to have this come back. So Bonnie, for everyone who's participating today, Bonnie and I got to talk this morning, and she explained her multi-pronged approach to taking on vaping. So will you just give us an outline, Bonnie?
Absolutely, thank you. So really, it is a four-prong approach to really trying to tackle the teen vaping issues. So first, most important, research. The second is prevention education, preventing teenagers from using electronic cigarettes in the first place. Third is cessation and quitting, to help the Lucas and the other teens out there who are using to stop. And then finally, advocacy, to go out and be an advocate against the big vaping companies.
Mm-hmm. So I'm really proud that Stanford Children's Health and Stanford Medicine are taking this on, and I'm so glad that you're here leading the charge. One of the things that we can do from academic medicine, as you said, is research. So will you give us a little sense of what you're focused on and your projects right now?
Absolutely. So really in the world of vaping, my research really tries to understand why teens are engaged in and motivated to use electronic cigarettes, what motivates them, what are the cognitive, the psychosocial, so thinking, the emotional factors that go into making decisions around vaping, what are the environmental cues that go into it, what is really going on. And taking the findings that we have to translate those rapidly and responsively translate that into regulation and into prevention. So of course my research gets published in a journal, absolutely. But in my lab, we are absolutely committed to making sure that everything that we do research on helps with prevention, cessation, advocacy, and policies. So to go into that a little bit more, what are we doing? So we really survey and interview and understand adolescents and young adults, really from 10 to about 23, 24-year-olds, why teens and young adults are making the decisions. What are their motivation? What role does marketing play in their decisions to vape? So we have studied and looked at the marketing, the bling, the cool packaging, the cool dancing figures that are adults but look like they're 16, that the cessation claims that are actually illegal claims but that are out there and they really attract young people, the colors, the really misperceptions that are out there. We do research on those. We really play a large role in looking at flavors. We were the first to really study Juul and the flavors in Juul. And we were the first to really show that that for Juul and other e-cigarettes, youth are using not just fruit and not just candy or dessert flavors, but also mint and menthol. And our research was used directly to advocate both in California and nationally for laws to eliminate the sale of all flavored tobacco products, because we were able to show that teens are using certain flavors and that the reason why they're vaping is because of those flavors. We also have research on nicotine levels. I don't know if you know this, but there's as much nicotine in a Juul pod as what you would find in 1.5 to 2 packs of cigarettes. So in our work, if you look at how much Luca was using, 4 pods, he was really using the equivalent to 4 to 8 packs of cigarettes worth of nicotine, a tremendous amount of nicotine, and teens don't understand that. Adults don't understand that. So why do we allow so much nicotine? That's part of our research. And finally, well, not finally, it's really endless, but in this, and thinking about it with you, we look at misperceptions. So when teens, like Lucas said, he thought it was water, he thought it was water vapor, or they think it's just essential oils. I hear that message all the time, and it's really important to be able to take the research and say, you know what? Let me correct those misperceptions. Let me correct the information and actually explain to you what really is involved in these tobacco products.
Wow. Tell us specifically, you mentioned prevention, and it seems like that's the ultimate goal, to keep kids from trying this in the first place. So what are you doing related to prevention?
Absolutely. So we really take the research that we have, that we know is very important. And by the way, all of what we said is important because research really is what grounds the prevention messages, what really grounds all the work we're doing. So we know with the Lucas out there, for example, if we had been able to help prevent, that would be where we start. We need to help prevent teens from using in the first place. We don't want teens to even try these products. Prevention and education is the key. We know from our research and others that over 27% of adolescents are using vaping products, and likely even higher. So I used to, now we do it through webinar, but I used to go to schools and communities throughout the country, talking to educators, talking to parents, talking to teens, talking to healthcare providers. And you know what? That's at 27% that the numbers are showing are actually lower than what's reality. We're really seeing that at least 40, 50, 60% of teenagers seem to be using these vaping products, and a lot of those are addicted. So our research really tells us how we should be talking to teens. What are the best messages to get out there? So for example, with Luca telling us that he thought it was water vapor or that there's no nicotine, or I hear a lot of teens tell me, you know what, it's just flavored water. And we say, well, it's not. There's nicotine in there. Or you think it's a flavor, you know what? Flavors themselves have harmful ingredients that we worry about. The buttery flavors, the cinnamon flavors, those all hurt your lungs and your heart as well. So it's really important that we talk and have these messages that help them prevent. We also know, teens, probably doesn't surprise you, are not little adults. We have to talk to them differently than we talk to adults. They think differently than we talk to adults. So telling a teen, you can get lung cancer in 30 or 40 years, that's not going to change a teen behavior. They care about now. We know that. Again, I'm a developmental psychologist. I look at teen development. They're not thinking about the future. It's now. So we know that we have to address the messages for teens that are most directly relevant to them. So telling them that, you know what, you smell bad, or telling them that it's harder to breathe and it may be harder to compete in that running or in that triathlon you might want to do, or saying, I love taking some kid in the audience and saying, if you smoke or you vape, it's harder to have sex. That's what they care about. That is way more effective. So our research really was instrumental in being able to help understand the messages that we need to. So I know there are a lot of parents who are probably listening right now. Just to give you some thoughts on how do you translate these messages. Start talking early, even in elementary school. Help them learn now. Help them make those healthy decisions now. So the goal right now is to have a conversation. Find the right time to talk to teens and be patient about it. Avoid saying, we need to talk today at noon, or you don't vape, right? Instead, use this webinar as an example. I just heard a webinar. I just listened to a talk. I'm curious about vaping. It's the first I've heard of it, or I don't know enough. Can you tell me what you know and have a dialogue? You may not find out today if they're vaping, and that's okay. You're building trust. As Luca would often tell me in our youth advisory meetings, he would say, I need to build trust with an adult, and then I'm more willing to tell them what I'm worried about and to be honest about the things that are hurting me. We also need to have evidence-based messages, and that's what's important. So I want to briefly tell you about our toolkit. That's probably the most important prevention message we have right now. We have the Tobacco Prevention Toolkit. I think we'll send you information on it later. It's a completely free, online, accessible toolkit that can be used by originally just mostly educators, but it's grown to be used by parents, by healthcare providers, by teens themselves, by everybody who's interested in understanding more about all tobacco, including e-cigarettes. Our toolkit has information and activities and PowerPoints and games and quizzes all about e-cigarettes, tobacco in general, information on nicotine in the brain and nicotine addiction, all kinds of resources and cessation materials on there. We also have information on COVID and vaping. So this toolkit's used in every state in the United States. We're being used in every county in California. We've reached over 1.5 million youth in just a couple years. That shows how needed these resources are. And it's right now being adapted to meet the needs of parents, youth, healthcare providers, and new products. Every time a new product comes on the market, we put a new lesson on. When we went remote, when we had to start teaching youth from home instead of in classrooms, we adapted our toolkit to become a remote learning curriculum. We have peer-to-peer activities and everything. So we really are trying to be evidence-based and use that to change and be malleable to help youth right now.
That's great. I just made a note to make sure we send to everybody who's participating a link to the toolkit after this is over. I do want to ask about a little bit of the scary part of, let's say prevention doesn't work or we don't reach kids in time. What can you advise about helping kids stop?
Absolutely. Well, sadly, as we do know from Luca, there are a lot of young people who just take a taste and they become addicted. And it's not hard. Our adolescents' brains are developing. They're significantly more likely to become addicted to nicotine or to any drug, really, than our adults. So when you listen to stories like Luca's, it's really heartbreaking. And so I'm really passionate about the Lucas out there and really want to help stop. We can't keep having teenagers like Luca fly 3,000 miles away and pay for it to be able to get cessation materials. We need to scale up and be able to have cessation for every teen in their hometowns and in their homes. So we know that unfortunately there are no FDA, Food and Drug Administration, research validated cessation programs right now. We don't have nicotine replacement therapy as an approved nicotine addiction tool right now. So our goal in our lab is to figure this out. We're going to help the Lucas. We're already working on cessation materials. We're trying to really work on how do we bring motivational interviewing, cognitive therapy, medications into the homes, into healthcare providers to help young people now so that we can empower them. Our goal is to empower all the youth, their peers, their parents, their providers to really help themselves and to help their parents and to help the Lucas be able to stop quitting. So that's a big goal of what we're trying to do right now.
Mhm. To take it so seriously and to say we got to do everything we can to help kids quit as
Absolutely.
fast as possible. Yeah. It's such a big problem, and it's a problem for individual kids and families and schools and communities, but also at the public policy level. And I know you have worked on that. Can you help us understand what you're trying to do to make that kind of system level change?
Absolutely. Thank you. So I've really been fortunate to be invited to present and testify across the country at the FDA, in Congress, at the CDC, in many states, in California included, to be able to go and testify to regulate some of these products. As I said before, if we can show certain flavors are the ones that are attracting youth, or in this case, really all flavors, if we can show that a particular box on Juul, for example, messages, or a particular color or a particular misperception is being pushed by the tobacco industry and the vaping industry, then we can use those data and go to the FDA, go to CDC and other places and say, we need to regulate this. If it's the blue lever that's causing the problem, we should not have the blue lever out there because we need to protect our kids. So been fortunate to be able to go in California, for example, there's Senate Bill 793 that will eliminate the sale of all flavored tobacco in the state of California. I was their key witness when it was on the on the Senate side, and worked with Senator Hill on that. And now it is moving into the Assembly side. And in fact, next week just got an email to go help out virtually, to go help out to make sure that that bill passes. My work was instrumental in Idaho and in Rhode Island in getting state level regulation about tobacco and particularly electronic cigarettes. My work with the Institute of Medicine and National Academies of Sciences led directly to the policies around tobacco 21, meaning that no tobacco should be sold to anybody under 21. So been very fortunate to be able to really work with state and local, state and federal level agencies to regulate and really be evidence-based, but there's so much more to do and so many more policies still needed right now.
Are there particular advocacy groups or places that you want to get in front of?
I would like to go to all the cities and states and federal agencies, more of them, to be able to get them to listen. But I will say, I haven't been as much in front of school boards other than in California. I'd like to be able to do that more and really help with policies at the school level. I've been fortunate to get in front of a lot of the big state, like I said, I'd like to go to every state, but some of the states and the FDA, the problem is that they don't always listen. They'll listen, but they won't have a dialogue. And, as I said before, we're really looking at big tobacco. We're looking at big vaping. We're looking at people who have extremely powerful lobbyists on their side. And so it's been very difficult to push through. We're making good inroads, but it takes a lot of time and energy to be able to go out in front of those groups and get them to listen and then to take action.
Is this a place where you feel like philanthropy could make a difference for you?
Oh, absolutely. So, we're, as I said, working against the tobacco industry. The tobacco industry has a great deal of money. You may know, if you're listening, that even Juul, for example, the most popular e-cigarette brand out there for teenagers, they were bought 35% by Altria, which is Marlboro. So even the smaller vaping companies are no longer smaller. They have millions and often billions of dollars and power to be the lobbyists, to be able to do the work that they do to attract our kids to start using their products. This is David and Goliath, really. There's no time to waste. Philanthropy allows me to be nimble and to respond quickly to keep pace with those companies, because those companies have thousands of people and billions of dollars to work fast. So for example, the flavor ban that I was mentioning before, we were able to use some of the philanthropic dollars that we already got to study the flavors that are out there, to be able to give data to the federal and state levels to work on flavor bans. We recently published some work on COVID and looking at other products that kids are using right now, Puff Bar and other things. And that was because we had a little bit of philanthropic dollars. Infographics, we were the first one to really put out in working with Department of Public Health that smoking and vaping are related to COVID. So these all take being agile. We can't wait for NIH funding or other formal funding that can take 1 or 2 years to develop. We really need to be able to have those dollars handy. So when a new product comes on the market, there are new tobacco products coming on the market all the time. When there are new issues, when there are new diseases, we are able to be front out of the gate to really not only study it, but then again, translate those findings into prevention, cessation, and advocacy.
I really believe in that philanthropy can be a lever, that you can have a huge impact for not as many dollars as you're talking about the big tobacco companies have to put to this. And it's something I really admire about your work. And I'm just so committed to helping raise support for your work. I'm starting to see questions come in. So we're going to turn to that in just a moment. And I encourage everybody who's participating, if you haven't yet, go right ahead into the Q&A button. But Bonnie, right before we turn to that, I thought I'd ask, do you see something at this moment, or is there reason for us to have hope about vaping?
There is, as much as what we've been talking about is kind of depressing, there is reason to be hopeful. One is, in a strange way of thinking about with COVID, we know it's a respiratory disease. It's affecting people's lungs, but it gives us a platform to be able to go out and talk to teens and say to teens, you know what? Vaping hurts your lungs. So we actually have a paper coming out in a couple of weeks, and we can send that later. I can't give all the details yet until it's published, but we really are the first to show a relationship between vaping and COVID amongst adolescents. We also know that teens are really trying to reduce or cope with the stress by, some are certainly trying to vape more, but we also know that about a third of teens we just recently studied are trying to quit during this sheltering in place. And so teens are really taking a more active role in realizing, you know what? We want to try to stop this problem. I have a youth advisory, youth action board. Luca's part of it. You know, somebody who has been vape free, who used to vape, who's really trying now to take action. So we know that now's the time, that the time is right to really start helping people, and that there is an open forum for people to be able to listen to it. So I think with science, with the prevention, with the advocacy, I'm starting to see a glimmer of hope right now.
I feel hopeful about the peer-to-peer piece from your advisory board, and also just from different students going out to their peers to try to help them learn about it and stop too. Okay, I'm going to turn to questions. The first one that I see is about adolescents with ADHD. And is vaping more addictive? How difficult is it for someone who has ADHD to quit compared to somebody who doesn't have ADHD?
So we don't have a lot of data that I know of, and I can look into it further for this person who's asking this great question. But we don't have a lot of great data on whether people with ADHD find it more or less likely to become addicted or harder or not to quit. But we definitely know that teenagers and some adults think that if you have ADHD or any other mental health issue or anything that you're struggling with, depression, whatever, self-medicate. So a lot of people will use nicotine in thinking that it will help you concentrate. And in reality, it doesn't help you concentrate. In reality, what you're doing is you're really pushing off dealing with the problem at hand, and instead using nicotine as a way to self-medicate. And what happens is, when you then are going through the withdrawal, you haven't used an e-cigarette or any tobacco nicotine product for a little while, your body really wants you to use it again. And so you actually lose concentration instead of gain it, because you're thinking about the next hit rather than saying, I need to focus on school or something else. So it's hard to know if you actually become more addicted, but we definitely know that it is something that makes it harder for you to concentrate, not easier. And I would recommend, to the extent possible, working with your young person and working with healthcare providers to find alternative ways to manage the ADHD.
Mm-hmm. Mm-hmm. What could you just, like, real life, how can we find out if our kids are vaping?
Absolutely. Well, as I said before, I wouldn't outright ask them. I used to talk to parents who would say to their kids, "You're not vaping, right? Or you're not having sex, right? And what's your teenager going to do?" No, actually, Mom, you're wrong. It's just really hard to have that conversation. So start by talking and saying, have some. I mean, every parenting style is different, and I can't tell you all what to do as a parent. But I can say that if you can say, "Look, I want to have a dialogue. It's something I just learned about. It makes me very worried. And I would like to know if this is something you're going through right now, or if you have friends." Sometimes it's easier to ask if you have friends. If you have friends who are going through it right now, that I'm not here to judge you. I'm not here to get angry, even though I'm a parent. I know you're going to get angry at some level, but that's not going to help your teenager be honest with you. That it's this contract. I used to say to my own daughters, if you're going to go drinking and I don't want you driving home, if you call me and you tell me that you need a ride home, no questions asked, I will pick you up, because I'd rather that you were honest with me that something's going on than I found you on the side of the road, either arrested or dead. And so being honest and saying, let's have this dialogue. And if this is something you're going through, I want to get you help because this worries me, and not because I'm going to be angry with you. And that's the best way to open up that dialogue. And I'll tell you, if their friends are using, you can ask about that. And if they, there's a not a good chance, I'm not saying definitely, but there's more of a chance that they're also using it, because as what happened with Luca, it's often a social issue going on. The final way that you can know is if they're vaping a lot. Then one is if the room smells. I always tell parents, if your room smells like blueberry and strawberry and banana, it's probably not fruit salad. They're probably using a vaping product because they smell good. If you find that they are having a lot of headaches, that's a very, very common sign of nicotine addiction. If they're antsy, moody, they can't sit still for more than a few minutes, they're going to their room or their bathroom. And I mean beyond normal teenage. Teenagers, I know, get antsy, get moody. But this is like an extreme difference, and they're coughing a lot, then that's a good sign that they may be addicted.
Do you think that the healthcare system is ready to help kids with this? You mentioned working with, with pediatricians, but are they ready? How do you ask for help?
So I don't think, we're getting there in the healthcare community, but there's a lot more work. And I'm actually working with the American Academy of Pediatrics. We're doing classes for healthcare providers, pediatricians, and adolescent medicine docs to get them more up to speed with how do you ask these questions. We have a lot of docs who are just saying, do you use electronic cigarettes? I might use that term as an academic, but really teens use vaping, juuling, puff bars. They're using other terms. And so to simply say to a teen, are you using electronic cigarettes, you're often going to get a no answer. So we need to teach parents too, and healthcare providers, the right terms. They don't know, because we don't have FDA approved nicotine replacement therapy. Healthcare providers are worried to use it, but we know that they can and often do use. So those are some of the work we're trying to do, is to figure out and help providers know how much nicotine to give teens, nicotine replacement, and how to help them. So I think we're getting there when you talked about being hopeful, but we have a long way to go to really teach. And that's something we're doing. We're building a healthcare provider hub on our toolkit to really give healthcare providers the resources that they need, brochures, links, talking points that they can both use for their patients and for their parents.
Mm-hmm. Mm-hmm. So what you just said made me think of something, which is that the first time I heard you speak was 2 years ago. It was a board meeting of the Packard Children's Hospital. And it was the first time I had heard of Juul and juuling. And just now you used the word or phrase puff bar, which is now the first time I'm hearing that. So one of the questions that came in is, what are the latest trends we need to be aware of? And the vocabulary and the vernacular you're talking about. I'm just going to write some down, but what else besides puff bar and Juul should we be learning about and looking up?
So puff bars are Juul's what's called a pod based or cartridge based product. So because you can take the little pod out, that's where the nicotine is in. You can take and move that out and replace it by a new one and put it back in. Puff bars, and I should say, and a Juul has about 200 puffs in it. And again, that's equivalent to about 1.5 to 2 packs of cigarettes. A puff bar is a newer disposable. It looks very similar. My dogs clearly don't like Juul and Puff Bar. Sorry about that. They are a similar kind of Juul. They look like it, but they're disposable. So you have about 200 to 300 puffs on that. And then when you're done, you throw them out. And so that's the big difference. And the Puff Bar come in a lot more flavors, and they're very popular. Now, Puff Bar supposedly literally just last week pulled their products off the US market, but then I just had a teen advocate who said, yeah, I just found the same thing under a different name. So we need to be super vigilant. If you parents, people listening, see anything that's small, that's colorful, that smells good, that looks like a USB, these things are made to trick us. They're made to be hideable. Stealth vaping, we often would say. They're tiny. So, it's about this big for the whole product, and the actual pod is only the size of a small paper clip or a quarter. So be on the aware on those. There's also Soren is another popular one. Soren looks like a teardrop or a highlighter. It looks like a highlighter. Blue, BLU, are also popular, not as much. On the West Coast, Stig, STG are more popular. So there are a lot of different ones, and we are seeing new products all the time. And it's hard to keep up with. We do keep up with them as much as we can on the toolkit and putting new pictures on there and new information for you all the time. But it's really hard to know.
Just so many things. Where do kids buy these, or where do they get them?
Yeah, so sadly, when we were more able to go into stores, you can just walk into a store, a vape shop. You can walk into a 7-Eleven. Now in California and in federal, tobacco 21 means that you're not allowed to buy these if you're under 21. I know so many examples right here in Palo Alto, San Mateo, our counties around here, where you can walk in as an under 18 as well as under 21 and be able to buy these products. They're not being carded. And it's one of the reasons why we want to eliminate the sale of these products, period, because it's so easy. Now, we know now some of the new data we have coming out suggests that teens are getting some of these products online more because they can't go into markets and stores because of COVID. They're also getting them from their friends. Somebody who looks 20 or 21 goes and buys them, and they're sharing them. And that's also why we think they're more at risk of COVID is, I have one, I share it with you, and you share it with somebody else, and we're sharing them around. And then the hand to mouth is also another COVID issue. So anyway, that's where they're getting them, is mostly friends, vape shops, which we need to do some more regulation on, and online. And we have no online regulation right now, period. And that's another big problem.
Would you, let's say your kid says, well, at least I'm not smoking cigarettes. Would you, is there a response to that, or is vaping healthier or safer than smoking cigarettes?
So we used to think vaping was healthier, not anymore. Most people you would talk to, including myself, would say it's not that they're healthier, they're different. Their risks are different, but they're just as risky. No, they don't have tar, but we don't know about cancer risks yet. We haven't had it on the market. Remember, it took 50 years to figure out cigarettes. We've only had electronic cigarettes on the market in the US since 2007. We didn't have really an increase in use until 2014, and then 2017 we saw the big increase. So we haven't had these on the market long enough to really know. But if you ask anybody to look at the ingredients, most people would say you're going to have cancer risk, you're going to have heart. We already know about heart risk. We already know about lung risk. So they're really not that different. Plus, they have the added issue of propylene glycol and glycerin. Those are the oils in there that bring the flavors through your body and into your brain. And we also know that they have metal and plastic in them that you're breathing in. So some of my colleagues and I, you would say, yeah, maybe you're talking about jumping from the 20th floor versus the 25th floor. They're both going to have the same outcomes. Let's not chance it.
Yeah, that's pretty stark. One of the questions that came in were, I think this is a train of thought about influencing and what influences kids. We heard from Luca and from you about, peer-to-peer influence to try vaping. What about social media? And I'm learning about TikTok as a social media. What is that impact on vaping?
Absolutely. Well, the vaping companies, and in particular Juul and Puff Bar, got really smart in using social media as their way of advertising. So you're not going to see them on TV, even though it's not illegal yet. Unfortunately, cigarettes, it's illegal to advertise on TV and radio. That's not the case with the other products. We have a lot of work there as well. But what we found is that with e-cigarettes, they are largely social media. And my own daughters would say to me, I would be on YouTube or whatever, and I'd see this big plume of smoke coming and these games for various products. So very much getting to them through TikTok, through YouTube, through other social media channels, Twitter, and whatever it is that they're using, not Facebook, but others. And so that's a huge influence. We also know Juul and others have been using influencers that are people who look like a teenager, who are older, who were really put there to say, this is the best thing I've ever used. Or I was at a basketball game and somebody tweeted out, boy, I bet they'd like a Juul right now. And we don't have proof, but probably that person was paid for by the industry. So there are definitely ways that the industry is trying to promote these products in real life in ways that look like peers are using them, that teenagers are picking up on and saying they must be cool, like what happened to Luca.
Wow. In addition to some of the ways you told us about, one-to-one telling kids like you're going to smell bad, you're going to have problems with sex. What about this idea of like you're being manipulated by big business? Is that helpful? Do kids care about that?
So they do. And actually our toolkit uses a lot of that messaging idea, which is you are being targeted, you are being manipulated. Same thing with nicotine. When you tell a teen, the problem with nicotine is you become a puppet. And teens don't want to be manipulated by anything. So if you can say, you're more likely to, you're being targeted, you're being manipulated. I often tell a teenager, I love particularly young people, in addition to say you're less likely to have sex, I also say, you know what, you're the next smoker, you're the next vapor, you're the replacement for the 400,000 people who are dying a year from it. And you get teenagers, I'll never forget talking to a middle schooler who said, Dr. Bonnie, I don't want to be a replacement smoker. I don't want to do that. I said, great, let's channel that and get you not to use. So that's why some of the initiatives that really talk about this is what the industry did to you. Look at flavors. Do you really think that an adult cares about unicorn poop and sugar booger as their flavor that they're using to help them quit cigarettes? No. These are flavors, these are ads to get a teenager to use. And that often really gets them jazzed and gets them angry, which is what we need to get youth involved.
Well, bringing it back to, we can all get super angry about this. As you said, you have been, we can ask kids for that too. Do you have a quick final word for our group? I see we're running short on time. So a final message.
So I think, we've been talking very seriously here for 40, 45 minutes. I think the most is to say that I am hopeful. I've been, doing this for many, many years, and the last couple of years, or last few years, been focused on vaping, and the last couple of years had more and more young people, middle and high school students, email me. I get an email almost every day from a teenager saying, I want to get on board to stop vaping. I want to help. What can I do? And I think that's where the hope is coming from. I have more teens now wanting to help to stop this, and teens who have used or teens who are using. And so I think there's been a big groundswell. It used to be I would go to schools and it was not cool. And it's still not greatly cool to say I don't want to use, but it was really not cool a year ago. And I think it's starting to change. And that's what it's going to take, is a big swell of social norm change and a big, us being the influencers now instead of the industry. So I am hopeful. I'm also hopeful with COVID. Well, as hard as that's to say, that I think teenagers are waking up between COVID and other lung diseases we've seen related to e-cigarettes, and say your lungs are important. You're only 16, you're 13, you're 14. Luca was 14. That, you know, we have that platform to write on to say we need to protect you, and let's protect you by helping you not vape. So I think there's some hope.
I hope so. I'm going to say thank you so much, Bonnie. Thanks to everybody who participated today. We have some patient families, we have community members, board members, donors, and we're going to follow up. I'm going to send a note out to everyone who participated with a link to the prevention toolkit that we talked about. Also, we'll send a recording of this webinar in case people want to forward it to help educate your family members and your friends. We have a document that summarizes Bonnie's work and ways that you can support it. And I really encourage people to think about making a gift to support Bonnie and this incredible work. And then most important, or most meaningful of all, we have a follow-up video message from Luca, who recorded it after he heard we were doing this, this webinar. So we'll send that out to everyone. And I'll just close by saying I hope we will stay in touch. We are doing another desk side webinar in August. It's on the 26th of August. And that session is with some more faculty members who focus on adolescent mental health and how parents can support their kids' mental health during what is just the most crazy, stressful time. So I look forward to seeing everyone there, and thank you so much for today.
Thank you.